Chers collègues, c'est un grand plaisir d'être ici. J'aimerais remercier INSERM et la Fondation de l'Académie de médecine pour leur invitation. It is a great pleasure for me to talk about vitiligo, which is I'm very much interested in it. It has India has a lot of concerns for India. So vitiligo is a pathology. You have white patches. It is very frequent because in the nearly 1% of the world population is affected by it. It shows that there is a loss of melanocytes. We should know that for a long time we considered as a aesthetic pathology. But we know that today it is depends on the quality of life, social, sexual, and professional relations are affected. Difficulty to find a job and heavy burden of this disease. It creates depression and cancers also. Now I know that they are obliged to spend more money and have more problems in their daily life. Vitiligo is white patches. It can resemble at times, can be mistaken for leprosy. Doctor will be able to tell you the difference, but for the general public it may not be so. It has more showed clearly that the person with vitiligo, they were willing to spend a lot of money to get cured. What does it resemble? These are white patches acquired and depigmented. It is there are two forms of vitiligo: segmentary vitiligo. It is only on one side of the body, and then the traditional vitiligo you have which affects the face and the lower limbs. You can also have a mixed vitiligo, for instance segmental vitiligo and secondary development of vitiligo. It can also bring about the loss of melanocytes. It is somewhat like a leukotrichia. You will have white hair all over your body. It is possible because people who have multichrome vitiligo, you can have white patches, but you can other multichromal vitiligo. Then we have another type which is called halo nevers. These are big patches. These are congenital. There will be a depigmentation around these patches. So you can always develop a bigger patch. These patches are not totally white, they are clearer than the rest of the skin. Then inflammatory pathology can also lead to loss of pigmentation. For instance, eczema can lead to this situation. And then there are other diseases like the psoriasis, which can lead to white patches. There is an inflammation here, but the depigmentation is not complete. There is a phenomenon called Koebner phenomenon. Development of vitiligo on sites with trauma are repeated frictions. You see here that it is very difficult when a person suffers from vitiligo. We are not in a position to tell him how it will develop further, whether it will be rapid or gradual. We cannot tell him. We don't have the means to predict the development of vitiligo. We have fortunately data which will help us to stop the evolution of vitiligo in the near future. And there is a general idea that a person with vitiligo will develop skin cancer. This is not correct, especially those who are interested in cancer studies. We people who will respond to this treatment will are those persons who have vitiligo. We should not tell these patients not to stand in the sun or to expose themselves expose themselves too much to sun, but then we need ultraviolet rays to cure vitiligo. Vitiligo is a psychosomatic disease, polygenetic multifactorial factors are responsible, and other factors of the immune system have a crucial role to play in vitiligo. They can lead to a worsening of vitiligo. It has as far as pathophysiology is concerned, we should know the difference between segmental and non-segmental vitiligo. There are other associated diseases. You have inflammatory bowel disease, hyperthyroidism, hypothyroidism, diabetes mellitus, etc. There are genetic analyses were done in vitiligo families. When you have a vitiligo, that first line of descendants have a greater risk of developing vitiligo, 5% if one first degree relative, and 25% for true twins. There have been studies of the genetic associations. These are called Jiva studies, and they have tried to separate the gene associated with vitiligo, and these genes are associated to the data of survival have underlined the important role of immunity. There is a cytokine which is 6CL10, which is a chemokine of IFN-Y. So you have here a mice model of vitiligo. We can prevent totally, completely vitiligo. We have also studies which are aiming at developing monoclonal antibodies. There are molecules which we know for a long time, and these can help in the treatment of vitiligo. When the mice were treated with simvastatin, there was a decrease in depigmentation. There are other studies to determine if these can present the spreading of vitiligo. It is a disease which is very complicated. We had analyzed in the laboratory. So we have studied these patches. We had studied these patches where they appeared on the body, and we compared it to people who do not have these patches. So why is it important? Beta-catenin is a melanocyte cell. There were effectively contribution to make for the human being and not for the mice. When we have patients are submitted to oxidative stress, there is an increase in depigmentation. Oxidative stress decreases the pathway, and we have treatment with WNT agonists induces a differentiation of melanocyte stem cell. We had also seen it on the histological level also. Here there are no patches. In the other slide you have small patches. These are, we used melanocyte cells to repigment these patches. We have, there are melanocytes which are genetically predisposed to repigment. We can induce, at the same time, oxidative stress is going to act upon the melanocytes, and which might prevent the repigmentation. What are the treatment? In all cases, we have to avoid factors which trigger vitiligo. For instance, scrubbing your skin. In vitiligo, we have to prescribe treatment for a long time, 6 to 8 months. You have potent topical steroids and local phototherapy. When the vitiligos are generalized, we have to use photo UVA. There are active forms, then we need it is non-specific, and we hope that we can have a targeted treatment soon. As far as surgical treatment is concerned, it is good, stable, and localized vitiligo or the segmental vitiligo. In both cases, we have different types of surgical treatment. On the slide, you see some examples. Here it is the therapy is localized. Today we have combination therapy, combination of phototherapy and topical calcineurin inhibitors. It improves the rate of repigmentation. So we have brought out the study showing the global repigmentation of vitiligo patients. You see that the combination therapy has given better results as compared to phototherapy used by itself, and in zones which are difficult to treat, like for instance elbow, knees, etc. The combination therapy has proved more efficient. We had differentiated the melanocytes, and in order to find a total repigmentation. Here you have when you have vitiligo in the face, it's much easier to treat. It is true. But for the other parts, especially the extremities, it is very difficult. What people do is they try to camouflage and they go in for medical makeup and self-tanning creams, etc. It can improve the quality of life. So micropigmentation has to be used carefully. It is to use with great caution, interesting for lips and such parts. Rarely you can have vitiligo in the entire body except for few patches, few parts of the body. Then we can suggest depigmentation of the area, and which will be stable for at least 3 years. And we do a psychological evaluation. Here you have this patient wanted to wear a t-shirt, and so she went in for a depigmentation. Till now, there has been no possibility of repigmenting the vitiligo patient. So, if it worked in the first instance, sometimes we had also shown that a randomized study we carried out the experiment with a placebo, and you see that as far as prevention is concerned, 40% of the patches were depigmented, and then that could be the first preventive treatment to cure vitiligo. It is very clear that vitiligo has a strong impact on the quality of life. It is considered as an aesthetic pathology. So we have made today marked progresses in the pathophysiology. There are treatments are available place bodies, parts of the body such as the faces can be repigmented in many cases. Treatment of hands and feet, it is difficult. We hope that there would be treatments available for this purpose. Thank you.